Probably should have.
Yeah.
Alright, morning class. Today we're going to be discussing hypertension, some of the parameters, but specifically we'll be going over ACE inhibitors, what their mechanism of action is, and what their side effects are. Okay, so let's go ahead and get started. Alright guys, so who here can tell me what hypertension is? Okay, Teresa?
Well, my dad had it, and he told me it was just like a fancy word for high blood pressure, and I think he told me it was anything over 120/80.
Great, you know what, you're on the right track, but who can take that just a step further for me?
Oh, from what I heard, hypertension is actually anything over 140/90.
You know what, that's correct. But what if you came across someone that had a blood pressure of 135/85? What would that be? Natalie?
Isn't that considered pre-hypertension?
That's correct.
If we come across a patient that has a blood pressure of 140/90, what are we supposed to do?
You know what, that's a great question. Can anybody here answer that?
I guess first you would want to have them work on their diet and weight reduction. You would want to educate them on a low sodium and cholesterol diet. I guess you can teach them to maybe cook with salt or no salt. Spices, garlic, onion, herbs. Also, if they smoke, you would want to teach them not to smoke. You want to teach them to keep their stress to a minimum, maybe doing some relaxation techniques, maybe deep breathing, something to keep them relaxed.
Perfect. So, what if all of those things don't work? What can you do? Michelle?
Oh, aren't there any medications that we can give them to help?
That is correct. There are some medications that are used to help treat hypertension, but today specifically we're going to be talking about ACE inhibitors, okay? Okay, so who can tell me what the ACE and ACE inhibitor stands for?
Yeah, this.
Okay.
It's all about that ACE inhibitors.
In reality, it is one of the types of classification used for hypertension.
That is correct. Okay, so Jennifer, tell me what ACE stands for and two examples of ACE inhibitors.
ACE stands for angiotensin converting enzymes, and the medication in pril, so it'd be lisinopril and captopril.
Okay, so who can tell me what the mechanism of action is for ACE inhibitors?
When taking an ACE inhibitor, it stops the conversion of angiotensin 1 to angiotensin 2, which constricts your blood vessels, causing your blood pressure to rise. It also decreases the production of aldosterone, which causes your fluid retention to decrease, ultimately leading for your blood pressure to also decrease.
Okay, good job. So who can tell me what the side effects are? Possible side effects would be?
So some side effects would be headache, dry cough, neutropenia, skin rash, dizziness, fatigue, hypotension, and hyperkalemia.
Okay, so here's a scenario. Let's just say that we have a patient that is newly diagnosed with hypertension, and the doctor actually orders ACE inhibitors. So what can you as nurses educate your patients on what to expect with taking this medication?
Well, first, I guess you want to educate to the patient that these are all normal side effects. Make sure to inform the patient that when changing positions to do it slowly and carefully, because we all know that orthostatic hypotension can occur. You want to educate the patient and the family about infection control, such as washing their hands. Washing hands is a big part of everything. As a nurse, I would monitor the lab values such as white blood cells and potassium, and I would also advise the patient to never stop taking the medication abruptly. Boom!
How come we would have to advise them not to stop taking the medication abruptly?
Well, if you do stop taking the medication abruptly, they could go into something called a hypertensive crisis, and that is very bad. It's an emergency situation.
Oh, okay, thank you.
Okay, so let's go ahead and recap. more about all about that ACE inhibitors, all about that ACE. And remember, the N in trills. What was I supposed to say? Yeah. Sprinkler. Oh, wait.
The diet and weight reduction.
Up there, yes. Specifically.
What was the question like?
Michelle.
Oh, okay. I think
The nurses can do.
Oh!
Yeah. Okay. Wait.